my pleasure to introduce Mr. Philip Gray, the CEO and Chief Pharmacist of Quality Care Pharmacy, who comes with many years of experience in the field of pharmaceutical sales and more specifically in inventory management, pharmacy automation, policy and procedures management. With over 12 years experience as a consultant in the Bahamas, he also manages consultancies in the United Kingdom and the West Indies. Mr. Gray is experienced. He is currently active in the sales and regulatory aspect of pharmacy practice at Quality Care Pharmacy. He also functions as the pharmacy manager, marketing director, and assistant chairman to the board. His background includes Director of Pharmacy for Doctors Hospital, a pharmacy consultant with the Public Hospitals Authority, Chief Pharmacist for Stardust Pharmacy from the startup, consultant with Commonwealth Drugs Wholesale. He's also worked with the Diara Comprehensive Clinic in Exuma, an operations consultant for Smitty's Pharmacy in Sandy Port. He has served as the president of the Bahamas Pharmaceutical Association, and also he was the president during the passing of the current pharmacy legislation. He's the first chairman of the Bahamas Pharmacy Council, the statutory and regulatory body for the governance of pharmacy, in 2010. And he's also served as vice president for the Commonwealth Nations Pharmacists Association, one of 2 Caribbean persons to hold this prestigious office. Ladies and gentlemen, we welcome Mr. Philip Gray, who will speak to us on medication compliance.
Well, thank you for having me to be able to sit and to speak to what I deem a very complex but relevant and pertinent topic. Certainly in this age of healthcare awareness and understanding the complexities of healthcare management, medication management, these are the kinds of things that we need to be discussing and talking about so that we raise the awareness of our consumers. We don't just want people just purchasing healthcare, but we want to make sure that they get the best outcomes as a result of what it is that they do. So now when we talk about the whole area of compliance with medication, it's a very complex area because there are a multiplicity of reasons why patients are not adhering to the dosage regimen which they have been given. There are factors which include access. Do I have ready access to the medication in terms of easy access to the pharmacies? Do I have to pay for my medication? So the cost is a factor which impacts that. In addition to that, there's also the norms and mores of various cultures. So do I need to take the conventional medication, or is it that I can go and draw on the bush that Mama used to take all the way back in the day? They used to work better, I used to feel better, or whatever is in our mindset that impacts the way we think. And if you live in a more Northern America culture, then obviously you're used to the dispensing of medications and pills and that environment because it's preached through social media, it is preached through television ads, you hear all the benefits derived, you hear all the side effects. So all of these things are combating the patient, which impacts the way one tends to treat medication. So we need to look at that. The pharmacist ought to be and is the most accessible member of the healthcare chain. What do I mean by that? In order to see your physician, you have to make an appointment. Sometimes the physician may have appointments booked up for 3 weeks. If you're working for a nurse practitioner or a nurse or some other healthcare provider to come to you, it has to be scheduled. In the case of the pharmacist, the doors are open from whatever the hours are, from 8 to 8. So you have the ability to walk in at any time and be able to approach the pharmacist or members of the pharmacy team. You may have a little wait because of patients ahead of you, but you have the access to that member of the team. And it's important that while we're in the era of medication management and documentation, that you have a relationship with your pharmacist. I implore persons to try to adhere to going to a single pharmacy for their medications, and there's wisdom in that. The wisdom in that is that the computerized system, you get to know the patient better. The system is going to document what all your regimens are. If there are new drugs added to your regimen, and we recognize that there are contraindications, side effects between the two medications and so on, that all of this compiled. The pharmacist is not just dispensing a couple of pills, putting a label on it and throwing it out, but he ought to be looking at you from head to toe. He's assessing the wellness of the patient, looking at the medication regimen, and then counseling you to get the best outcomes, to make sure that you are most compliant with the medications that you are taking. Now, when we talk about disease states, just the other day we were talking just about the passage of the cannabis bill. There are 18 disease states where we're saying that the medicated cannabis is going to be applicable. So you imagine the myriad of products that are on the market outside of that, and just a single drug being able to impact 18 disease states. Certainly when you look at a pharmacy and you see the thousands of products, the various forms and compositions, the excipients, the active ingredients in pharmaceutical products. When you look at the fact that one patient could be on one drug, and some patients as many as 10, 15 products, and one product is taking care of the side effect of another product and so on. So there's a whole broad range of reasons why it's challenging sometimes for the patient. The educated consumer who understands what it is that they're taking, why they're taking, and why it's necessary to be taking it, is more likely to be compliant. And so you want a pharmacy and a pharmacist who's going to take the time, a physician who's going to take the time to explain to you, Mary, this is why I need you to take this, because your blood pressure is 180 over 110 right now. The range is this. This is what we need you to get down to. And if you take this medication over time, you're going to get the desired outcomes. We also need to be monitoring you as the patient on a daily basis on what your blood pressure, what your glucose levels are, and so on, so that you understand how is the medication impacting my disease state, and how am I going to get the best outcomes from taking what it is that I am taking. If you look at medication and if you look at packaging today, because we're in the era of lawsuits and legal fights and battles. So the product will say the product is good for this, but you have this whole gamut and spectrum of things, of side effects. Usually most of those side effects affect a very small populace. If you look at it, most of the persons do not necessarily get those side effects. But there is a small percentage when the FDA or whatever the regulatory entity is, which is approving the medication, has approved it. You realize that the benefits are going to far outweigh the side effects or the detrimental aspects of anything. I want to go back a bit to and define what a drug is, and I like to use this particular definition because it jolts people, but it helps them to understand why they need to be careful with and to really hone in and focus on their regimens. A drug is poison in small doses. If taken correctly, it may help to cure you. If taken incorrectly, it just might kill you. But the idea is that you want to take the medication because it's chemicals comprised and manufactured in a certain way for your benefit. And your physician, your pharmacist is looking at your whole basal mass, your weight, your height, your waist, your heart condition, and so on, and then determining what strength of that medication is going to give you the best results and outcomes. In that relationship, you want to be able to say if you are feeling the effect of something. First of all, your body has to acclimatize and get used to being on a medication, and then you will notice that, I used to have this dizziness before, or I had whatever the symptoms of my high blood pressure, and then I'm noticing that is decreasing and ceasing. So you want to be able to understand that. Now that definitely is a good trigger and an encourager to the patient to be compliant with his or her medication. At the onset, I've seen where diabetics, just giving a ride to a friend the other day, she's like, they've changed my medication and I don't necessarily feel so good on it. It has me feeling a little nauseous and so on. And sometimes that's just a matter of getting used to the medication, but sometimes it may mean that in a combination drug or the actual medication is too strong or it isn't strong enough, and so we may have to adjust the dosage. This is why the relationship with your pharmacist, who's going to be documenting in a system, and if they are on the MMD program where they are taking information for the patients that they can actually take back to their doctor after a month's time, so that we could look at regimen and say, well, maybe we need to just adjust over here a little bit, increase the dosage or decrease the dosage depending on what's happening with the patient. In a society or in an era where we have access to information, that also impacts compliance. What do I mean by that? I just read an article and it said, we just came out of COVID. One person is saying taking the vaccine is the worst thing in the world and it's going to kill you, and then we're saying if you don't take it, you may get the disease and as a result you die. The patient is bombarded with all of this information and they have to process that and determine what makes best sense for me. False information and fact checking and making sure that the information that you hear or receive on medications is also important, because it helps the patient to be compliant as well. So we want to make sure that at all junctures, whatever information you have, that you fact check it, you speak with your pharmacist, that you speak with your physician, and determine whether or not the impacts that they speak about, is it truly impacting me? Is this really scientifically based data or information, or whether this is just some one-off who is perpetrating to have information but giving false information, which has a tendency to scare the patient off from being compliant. when one is taking medication, the desire is to get the patient to what is known as steady state. Steady state refers to an equilibrium, the dynamic equilibrium, where the patient is absorbing the same amount of the medication that's passing out of the system. And so that you are at a place where the body is comfortable with that medication and giving you the desired outcomes. When you are at steady state, if you miss your medication for one day, you might still be in a good place because your regimen is being adhered to for the most part. And then you get back onto your regimen the next day. We don't ask people to practice that. What we're saying is that you want to always be in steady state because you're consistently taking your medication the same time every day if it's something that is to be taken on a daily basis. That usually impacts persons with chronic disease management. So your high blood pressures, your diabetes, your asthma patients, and so on. You want to be taking your regimens consistently so that you get used to the routine of taking it. You know, right after breakfast, I line up my 6 pills and I take those. I know that after lunch, I have another one that I take, so I take that right after lunch. Before I go to bed, I take, and you get used to it, which makes you a better compliant patient. If you're ad hoc about doing that, what the tendency would be is that, I take it at 10 o'clock today, at 8 o'clock tomorrow, at 7 o'clock as I catch in the flight, and so on. And if you're inconsistent with it, then there's a tendency to not adhere to your regimen. And sometimes you even go and you say, did I take it? But that was yesterday, and you're not sure. But if you have your medication laid out in your pill box, and you know it's Monday, Wednesday, Thursday, Friday regimen. So Monday is missing because Monday's passed. Today's Tuesday, my medication is there. If it's not in its slot, then I'm not taking it. If it's there, then I know. So there are ways that we can, in fact, help ourselves by using systems that are in place to help us to make sure that we are compliant from that perspective. There are some side effects of medications that are gender specific. What do I mean by that? You hear the male who says that he's on a particular high blood pressure medication and it's causing erectile dysfunction. Can we keep it real? The average man is going to say to you, well, boy, I ain't taking that because I embarrassing myself tonight. And so it makes it difficult. I've had patients, I had a patient at one point say to me, he say, you know what? I like sugar, I diabetic, they tell me I can't have that. I like salt, they tell me I can't have that. Now you tell me you can take away my things from functioning, I may as well do that, I ain't taking that. But it is important that we speak to the patient to make them understand that with taking your medication you live another day to be able to function and to do all the other things. And let's look at the backdrop of what happens when we're not compliant and all the whole myriad of possibilities. You end up with a stroke, a heart attack, a catastrophic event that makes you paralyzed. It's impairing your vision. You end up with neuropathy and so many other challenges, health challenges, that you are far better off with just being compliant with your medication. In addition to that, if we see gender-specific things happening, there is always an alternative, because each disease has several classes of drugs that can be used, and so there's alternate therapy for what it is that you may be currently taking. Sometimes, because what you used to take for my for my hypertension, I was taking a diuretic alone, and that made me go to the bathroom frequently. I didn't like that because it was causing me to go to the bathroom 4 times a night, and so whatever the particulars are. So then the doctor puts you on a lower strength of the diuretic with a calcium channel blocker or an ACE inhibitor and so on. But they have the opportunity to mix and mingle on the medications to get you most comfortable, to get the best outcomes from the medications that we're taking. What are we saying here? We're saying to you that if you have been prescribed medication for a specific disease state or disorder or challenge at any given point, we need the patient to be as compliant and adhere to the medication. Doing that gives you the best chance for having normalcy in functionality and being able to have the best quality of life. In your medications that are short-term, for anything from an infection to chemotherapy, you know that you're going to have 10 rounds of chemotherapy, or you know that you're going to be taking an antibiotic for 3 to 7 days or 10 days. It's important that when that medication is given to you, that you complete the cycle and adhere to the time frame that you're supposed to take it. So let's look first at a chemotherapeutic agent. The aim is to kill off as many of the cancerous cells. And so you're taking it, and even though there is the challenges that may come with it, so the side effect is that my hair is dropping out, I'm feeling nauseous. So obviously those are things that would make one say, well, let's not bother with that. But once you finish your 3-month, 6-month, 8-month treatment, the hair comes back, the nausea cease or is reduced. And so, and even whilst you're taking it, there are several drugs that we can give you to help you manage the level of nausea or discomfort. So we be compliant to the end point so that you get the best outcomes. With an infection, you've been given a medication with the understanding that to kill off that infection takes 7 days. The trick about it is I tend to feel better after 3 days, so I stop. And sometimes that becomes very dangerous. Let me explain to you why. So I usually say to people, you have this much bacteria or virus or whatever it is that's causing the infection in the body. Each day you take the medication, you kill off this amount. The next day you kill off, the next day you kill off. Times you get down here, you kind of feel better, pick up. The drizzles, the nose, the coughing, and cease. Oh, I need to take that no more. But what happens is then that bacteria reproduces and it comes back out. And then it comes back but it comes back worse than it was before because the strain becomes resistant to the antibiotic that you have been given. And as a result, we now, instead of giving you amoxicillin, we have to go to a second generation cephalosporin or a more complex antibiotic in order to fight off that infection. So it's important, even if we feel better, to take our medications to completion, be compliant with that so that you get the desired outcomes. Is there benefit to using home remedies, supplements, along with our pharmaceuticals that we're given? The answer is yes. But we also need to monitor that so that we make sure that there is nothing that's going to be prohibitive for you getting the best outcomes and the results. In the age we live in, another part of the science of pharmacy is called pharmacovigilance. And pharmacovigilance really speaks to the fact that if there are adverse drug effects, that we ought to be monitoring that in a country so that we understand that we've been getting product X, and based on our genotype or phenotype, meaning the diaspora of people, we have majority black people, so the way a drug affects our populace is going to be different. But if we notice that this drug coming out of the United States or India or Mexico, is there a challenge with the manufacturing of that product? Is it impacting our people in a specific way? And therefore it may not be the most desirable product for us because of our, as I mentioned, genotype, phenotype. So there's a whole myriad of things that has to be monitored, both from the clinicians and as well as the patients end of things, to get the desired results, to have less complications, to have less contraindications. But it behooves patient, physician, nurse, doctor to work as a team. We refer to it as a multidisciplinary, collaborative effort with the patient in the center, all the clinicians around working together to ensure that as we listen to the patient, we get them to a place of comfort so that we get the desired outcomes.
We are aware that some conditions, such as multiple sclerosis, requires treatments that are not readily stocked in pharmacies and require sourcing off-island. What type of processes do you have in place to encourage compliance and for our clients not to face challenge with obtaining their medication?
Okay, that's a real good question. Obviously, need and demand determines what one keeps in his or her dispensary. Obviously, if you have a large percentage of the population who are being treated for certain ailments, then you're going to keep more of a certain type of medication. So yeah, hypertensive medications, your diabetic medication, and even that with so many different classes, you have to monitor how much of whatever it is that you're going to keep, because in certain demographic spheres or population, you're going to see this drug being written for more than others. In the case of multiple sclerosis now, as the question has been asked, we're talking about a very small percentage of persons who are going to have the disorder, and then we're talking about the cost of medication. So there can be medications for that type of patient that's going to cost you anywhere from $200 a month to, you ready for this? $30, $35, $1,000 per treatment. Obviously, even as an insured patient paying your 20%, it's still very costly. And it also impacts the benefits of those in your grouping, in insurance, and so on. So again, like I said, there's a myriad of things going on that impacts that. Obviously, if my inventory in my dispensary is 200,000 or 300,000 or 500,000, I'm not going to keep a whole lot of a $50,000 drug that's going to be used twice a year. In my scenario, I've been able to network because of my relationships over the years with partners all over the world to be able to access medications that would otherwise not be normally available. And usually the time of getting that courier into country is the normal time to be able to get that to the patient. Usually with a multiple sclerosis patient, you have a window of opportunity to be able to get it for the patient. We know that Mary's regimen is required in 2 months, so the liaise with the insurance companies in advance allows you as the pharmacist to prepare for that patient to get the medication ready so that our physician and whoever is doing the infusion or giving the oral medication can certainly get it in sufficient time so that there is no break in treatment. The same thing applies for the oncolytics and chemo medications. And in this day and age, instead of infusions, a lot of times they can be in a tablet form, which makes it easier for a patient. But the cost can be astronomical. I mean, you can get a patient on something for $8,000 a month or $50,000 a month for his or her regimen. And so being able to get those in countries, being able to cross borders, to get the export certificates and so on, to make sure that there's no break in the chain of distribution, because you want good manufacturing practices, you want good distribution practices, so that you know that when you're getting a product to the patient, it is in good condition. We want to make sure that cold chain is adhered to through the whole traveling process, bringing that medication in, so that when it reaches you, you can safely say, with the safeguards that you have in place, that the tracking of the medication that has been stored in the right condition, it's traveled in the right condition, no seals are broken, no possibility of contamination, and I can give this to my patient with no fear of contradiction, that things are intact.
Okay, so great, thank you for that response. In your experience, is compliance or adherence a global challenge, or have you found that it's more to a geographical area, say perhaps the Caribbean versus the UK?
So, like the Bible says, there's nothing new under the sun. The same challenges we experience here in the Bahamas are being experienced globally. When we travel for continuing education to conferences and so on, we see that the same challenges we find here, we find elsewhere in the globe. So it's usually the same sort of challenges. The more educated consumer, so it depends on the demographic of the person, obviously is more compliant with medications. But overall, the same challenges occur globally.
I do have a follow-up to that.
Mm-hmm.
But are there any incentives, or is there anything that you do in your practice or at your pharmacy to kind of encourage compliance and adherence?
Okay, so the first thing is that you have the ability to monitor when refills should be happening. That is your best recourse or avenue to tackle your patient. So Mary Jo comes in for medication. She got a 30-day supply, but she's coming in 45 days later or 60 days later. That's a clear indicator that she's not being compliant. She's obviously either getting medication from another pharmacy or she's taking it. You know what? And you find out they'll be honest with you. They'll say, man, I feel like I needed to take that. So I was taking that every other day. So what one has to do then is to sit with them. Sometimes get them in a relaxed place. Take their blood pressure for them right then and say, let's look at it. Invariably, the pressure is 160 over 110. I say, you see, now you're out of range because you ain't take this for a couple of days. And I'm like, you're getting close to stroke proportions. Remember now that this disease is a silent killer, so it's not always so overt or obvious that something is awry until all of a sudden, and there's a trigger that causes an incident. So the ability to develop relationships with patients and to call them, sometimes that they just need the encouragement of having the contact. There are some patients, for example, who are on chemotherapy regimen, and not because they're not getting those medications anymore do you lose contact with them. So sometimes just a WhatsApp or calling to feel how their radiation is going now and so on, just to keep in touch and develop a relationship is more than transactional, where we say, I give you 30 pills, you give me $100, everybody's happy. But developing a relationship and a rapport with your patient so that if anything occurs in the middle there, they come back to you as a resource person to help them over the hurdle. You ought to be a friend to the patients that you care for and develop the rapport where there's comfort on both sides to discuss, remembering too that there's confidentiality in everything that's done and said.
So this is the care and quality care.
It is indeed.
Just as a wrap up, you spoke about the educated consumer. So as a tip for our consumers, Bahama Health consumers, we are aware that it is vacation time. A lot of traveling is happening. So it's important for our clients to know that Bahama Health do partner with the pharmacies to ensure that while they are traveling on their vacation, that they are compliant with their medication. And so we accommodate our clients that may be traveling, that may need, more than a month's supply. As long as they reach out to Bahama Health, we would ensure and contact the pharmacy to make sure that they have the necessary coverage for them to remain compliant.
I commend you on that because I tell you, particularly in my work environment where we're dealing with a lot of people who are on vacation, you would be astounded about the amount of persons who packed everything and forgot medication. I'm amazed at it. It is a daily occurrence of not just one or two persons. Or they remembered 3 of the 4 drugs when invariably the one that they deem is most important is in there. Or the symptom of something that may occur, like an inhalant for asthma. Well, I thought I was coming to have fun. I didn't think I was going to have, and invariably that happens. So it's important that as you travel as a consumer, that one of the things you take there to ensure that you have a good time on vacation is your medication, and make sure that you are equally compliant. I know some people say too, well, I can do a little drinking here, so I don't know if that's going to affect. No, you need to make sure that everything is in moderation so that you have the best time of your life on vacation and come back restored, but also in good health.
It's a Great. Can you also tell our viewers where can we find you? Where are you located?
Okay, so we're a nice drive over the bridge on Paradise Island, #1 Marina Drive, in the new Hurricane Hole Plaza, which is referred to as Sterling Commons. It is in between the police station and the Warren, right opposite the Atlantic staff parking lot. There's a gate that welcomes you to come in. You can't miss it.
Pharmacist Gray, we thank you for coming in and sharing with us. It's a wealth of information, and we're hoping that our general audience, our viewers, would have learned, and we hope to see persons being more compliant. There are really some essential tips you've provided as to why we need to be compliant with our medication and to live healthier lives. So we thank you for sharing and partnering with Bahama Health.
Thank you, and we take Bahama Health.